Once again, you are welcome to Angel Health Academy. The subject is Community Health Nursing. Topic for the day is Health Committees and Reports. Health Committees and their Reports. The session includes introduction, list of health committees in India in a chronological order, major health committees in India, other notable committees and their recommendations. Health planning is an integral part of national socio-economic planning of the country. Health planning is an integral part of national socio-economic planning of the nation. Health planning in India was started in 1938. Government of India from time to time appointed several committees to study the then existing health situations or health problems of the country and to report with certain recommendations to improve the health status of the people in the country. So, Government of India appointed several or various committees to study the existing health situations or health problems of India and give the report with certain recommendations to improve the health status of the people in the country. Thus, the guidelines for organizing health services and for national health planning were provided by a number of planning committees. The guidelines for organizing health services in India and for the national health planning that were provided by many committees or various committees in India. So, the planning committees are important landmarks in public health nursing. Planning committees are important landmark in public health nursing. List of health committees or health planning committees in India. List of the health planning committees in chronological order. First is Bohr Committee 1943, then Chopra Committee 1946, Soke Committee 1947, Shetty Committee 1954, Mehta Committee 1957, Mudaliar Committee 1959, Renuga Rai Committee 1960, Chada Committee 1963, Mukherjee Committee 1965 and 66. Mukherjee Committee was appointed in two times during 1965 and 1966. Then 1966 Government of India appointed another committee, that was Jain Committee, Jangalwala Committee 1967, Kartar Singh Committee 1972, Srivastava Committee 1974, Krishnan Committee 1982, Mehta Committee 1983, that is another committee, Mehta Committee 1983, Bajaj Committee 1986, and there are 4 other committees also. So this is the list of committees, health planning committees in chronological order. The other committees includes Health for All by 2000 AD, Report of the Working Group 1980, Working Group on Medical Education and Manpower Planning 1984, High Power Committee on Nursing and Nursing Profession 1987, Report of the National Commission on Macroeconomics and Health 2005. So these are the various health committees in India. Next is the major or important health planning committees in India. Major health committees in India. The major health committees in India include Bohr Committee, Mudaliar Committee, Chada Committee, Mukherjee Committee, Jangalwala Committee, Kartar Singh Committee, Srivastava Committee, Bajaj Committee and other notable committees. Let us discuss in detail about the major health planning committees in India. First is Bohr Committee. The period is 1943 to 1946. The Government of India appointed a committee was known as Bohr Committee under the chairmanship of Sir Joseph Bohr in 1943. This committee was also known as Health Survey and Development Committee. The objectives of the committee was to survey and report the existing positions regarding the health conditions and health organization in the country. To survey and report the existing positions regarding health conditions and health organizations available in the country. The committee submitted its report in 1946. The committee submitted its report in 1946. The recommendations of Bohr Committee includes: first is integration of preventive and curative services in public health. Integration of preventive and curative services. Second main recommendation, development of health centers and hospitals. Development of health centers and hospitals. And third one is preparation of social physicians. Preparation of social physicians. Let us discuss in detail about the recommendations of Bohr Committee. So the first recommendation was integration of preventive and curative services in public health. Second recommendation was development of health centers in two stages. One is short-term stage and another one is long-term stage. The short-term measures includes primary health centers and sub-centers, and the long-term measures also called as 3 million plan. The long-term measures also known as 3 million plan. It includes development of hospitals in 3 tiers. Development of hospitals in 3 tiers. Let us discuss in detail the short-term measures. First is setting up of primary health centers. The board committee were recommended each PHC in rural area should cater a population of 40,000. So each PHC in rural area should cover a population of 40,000, and there should be 2 medical officers in 1 PHC. So 2 medical officers per PHC and 3 sub-centers per PHC. So 1 PHC should cover 3 sub-centers. Then there will be a secondary health centers to serve as a supervisory, coordinating and referral institutions. So the short-term measures include setting up of PHCs. Each PHC in rural area should cover a population of 40,000, and there will be 2 medical officers in 1 PHC, and 1 PHC should cover 3 sub-centers, and there would be a secondary health centers to serve as a supervisory, coordinating and referral institutions. And second is long-term measures. Setting up of hospitals in 3 tiers. In first tier, primary health units with 75 bedded hospitals for each 10,000 to 20,000 population. So there should be a primary health unit with 75 bedded hospitals for 10,000 to 20,000 population. Then in second tier, there would be a secondary health units, or it is also known as regional health units with 650 bedded hospitals as a referral center for 30 to 40 primary health units. So for 30 to 40 primary units, there would be a secondary health units or regional health units with 650 bedded hospitals. In third tier, construct a district hospital with 2,500 beds. So in first tier, primary health units with 75 bedded hospitals for 10,000 to 20,000 population. In second tier, secondary health units or regional health units with 650 bedded hospitals for 30 to 40 primary health units. In third tier, district hospital with 2,500 beds. The third recommendation is major changes in medical education, that is to prepare the social physicians. That is 3 months training for MBBS doctors in the rural area in preventive and social medicines. So social physician means providing 3 months training for MBBS doctors in the rural area in preventive and social medicine. So these are the 3 important recommendations of the board committee. Next is Mudaliar committee. Period is 1959 to 62. Let us explain about Mudaliar committee. The government of India appointed another committee in 1959 under the chairmanship of Dr. A.L. Mudaliar. Dr. A. Lakshmana Swamy Mudaliar. The committee also known as Health Survey and Planning Committee. So Mudaliar committee is also known as Health Survey and Planning Committee. The objectives of Mudaliar committee were to survey and report the health needs and resources of the country in the context of 5-year plans. Government of India started 5-year plans in 1951. So to survey and report the health needs and resources of the country in the context of 5-year plans. The second objective is to review the progress made by board committee's report. To review the progress made by board committee's report. The committee submitted its report in 1962. Mudaliar committee submitted its report in 1962. The committee was subdivided into different subcommittees like medical care, public health, control of communicable diseases, population control, professional education and research, indigenous system of medicine, drugs and medical supplies, legislation, health administration and medical research. The committee was subdivided into different 10 subcommittees. The recommendations of Mudaliar committee includes regional service, regional organization and all India health services. So Mudaliar committee were given 3 recommendations. First one is regional services, second one is regional organizations, and the last one is all India health services. Let us discuss in detail the recommendations. So the regional services. strengthening of the district hospital with the specialist services to serve as a central base of the regional services. So district hospital has to be strengthened with the specialist services to be function as a central base of regional services. Then each PHC should not serve more than 40,000 population. The Board committee were recommended PHC should cover a 40,000 population, and Mudaliar committee recommended that each PHC not to serve more than 40,000 population. Then next is to improve the quality of health care provided by the PHC. So improve the quality of health care provided by the PHC. The output of public health nurses, health workers, lady health visitors and auxiliary nurse midwives to be increased. To increase the output of public health nurses, health workers, lady health visitors and ANMs. Then MCH services should be organized properly. Organize the MCH services. The second recommendation is regarding regional organization. There should be regional organization in each state between the headquarters or organization and the district. So between the headquarters or organization and the district. And this regional organization in charge will be regional deputy or assistant directors who supervise 2 to 3 district medical and health officers. So each regional deputy or assistant director supervise 2 to 3 district medical and health officers. The third recommendation was constitution of All India Health Services on the pattern of Indian Administrative Services along with the integration of medical and health services recommended by the Board committee. So these were the 3 recommendations of the Mudaliar committee. Next is Chadha Committee 1963. Government of India appointed another committee in 1963 under the chairmanship of Dr. M.S. Chadha. He was the then Directorate General of Health Services. This committee was also known as Committee for Maintenance Phase of Malaria Eradication Program. Committee for Maintenance Phase of Malaria Eradication Program. The objective was to study the arrangement necessary for the maintenance phase of National Malaria Eradication Program. So to study the arrangement necessary for the maintenance phase of National Malaria Eradication Program. The committee were given 3 recommendations, important recommendations. First one is setting up of primary health units. Second is regarding basic health worker, and third is regarding family planning assistant. That is explained in detail. First is setting up of primary health units. In that, malaria vigilance operation in respect of National Malaria Eradication Program should be the responsibility of the primary health centers at block level. So, it is the responsibility of the primary health center at block level for the malaria vigilance operation in respect of National Malaria Eradication Program. Second is population coverage of subcenter. Population coverage of subcenter should not be more than 10,000 with an ultimate target of 5,000 population. Then third is each subcenter should be staffed by an ANM, auxiliary nurse midwife and female welfare worker. Then there should be one health inspector for every 20,000 to 25,000 population. So in setting up of primary health unit, the recommendation were first is malaria vigilance operation in respect of the National Malaria Eradication Program should be the responsibility of the primary health centers at block level. Then population coverage of subcenter should not be more than 10,000 with an ultimate target should be 5,000. Each subcenter should be staffed by 2 staff, 1 ANM and 1 female welfare worker. And there should be 1 health inspector for 20,000 to 25,000 population. The second main recommendation regarding basic health worker in relation to malaria and family planning. The basic health worker should do vigilance operation through monthly home visits. Second, multi-purpose workers to look after the additional duties of collection of vital statistics and family planning in addition to malaria vigilance. So, multi-purpose health workers in addition to malaria vigilance, they have to take additional duties of collection of vital statistics and family planning. The third main recommendation was the family planning health assistant were to supervise 3 to 4 basic health workers. So each family planning health assistant should supervise 3 to 4 basic health workers. So these were the recommendations of the Chadha committee. Then fourth is Mukherjee committee 1965 and 66. So the government of India appointed another committee in 1965 and 66 under the chairmanship of Sri B. Mukherjee. He was the Secretary to Health and Government of India. This committee was also known as Review Committee for Family Planning. So this committee also known as Review Committee for Family Planning. So Mukherjee Committee appointed in 2 times in 1965 and 1966. The objectives were to check the results of malaria vigilance operation. First objective was to check the result of malaria vigilance operation, and second one was to review the targets of family planning program. There were 3 main recommendations by Mukherjee Committee. First is separate staff for family planning, de-link the malaria activities from family planning activities, and basic health services at block level. Let us discuss in detail about the recommendations. So the committee recommended to have a separate staff for the family planning program. And family planning assistants were to undertake only family planning duty. Thus family planning assistants were undertake only family planning duty. Then de-link the malarial activities from family planning. Separate the malaria activities from family planning. Then during 1966, the second committee recommended regarding the basic health services at block level. That was appointment of basic health worker for a population of 10,000 in malaria maintenance area, and a male supervisor to supervise the work of 4 basic health workers. So appointment of a basic health worker for a population of 10,000 in malaria maintenance area. Then appointment of a male supervisor to supervise the work of 4 basic health workers. Then appointment of 1 health visitor to supervise the work of 4 ANMs, auxiliary nurse midwives. Appointment of 1 health visitor to supervise the work of 4 ANMs. Then appointment of a nursing supervisor at the district level. So in 1966, the second Mukherjee Committee recommended regarding the basic health services at block level. That was included the appointment of male supervisor, health visitor and nursing supervisor. The next is Jangalwala Committee in 1967. So Government of India appointed another committee in 1967 under the chairmanship of Dr. N. Jangalwala. Dr. Naushir Jangalwala. This committee was also known as Committee on Integration of Health Services. Committee on Integration of Health Services. The objectives were to examine various problems like the importance and urgency of integration of health services. To examine the various problems like the importance and urgency of the integration of health services in public health. Second is elimination of private practice by the government doctors. Elimination of private practice by government doctors. The committee were given 3 important recommendations regarding integrated health services: equal pay for equal work and no private practice. So integrated health services, equal pay for equal work and no private practices. Let us explain in detail. The first recommendations committee defined integrated health services as a service with a unified approach for all problems instead of a segmented approach for a different problems. So integrated health services defined by the Jangalwala Committee, that was the integrated health services is a service with a unified approach for all the problems instead of a segmented approach for different problems. The main steps of recommendation of integration were unified cadre, common seniority, recognition of extra qualifications, equal pay for equal work and special pay for special or specialized work, and no private practice by the government doctors, and good service conditions. So the main recommendation of or main steps of recommendation of integration includes unified cadre. Unified cadre means unified work group or staff, common seniority, recognition of extra qualification of the staff, equal pay for the equal work and special pay for the specialized activities or work, and no private practice by the government doctors, and good service conditions. Next is Kartar Singh Committee 1972 to 1973. So Government of India appointed another committee under the chairmanship of Kartar Singh. He was the then Additional Secretary to Health and Family Welfare Government of India in 1972. This committee was also known as Committee on Multi-Purpose Workers. Committee on Multi-Purpose Workers. The objectives were To study and make structure of integrated services at periphery and supervisory levels. To study and make a structure of integrated services in public health at both peripheral and supervisory levels. Then to identify the feasibility of having multi-purpose and unipurpose workers in the field. To find out the feasibility of having multi-purpose and unipurpose workers in the field. The committee was submitted its report on September 1973. The important recommendations of Kartar Singh Committee were program on multi-purpose health workers. Second is staff and population of subcenter. Third area is female health supervisor, and last area is qualified public health nurse. So these were the 4 important recommendations of Kartar Singh Committee. Let us discuss in detail. The committee were recommended that multi-purpose health workers to be introduced in 2 stages. First, in areas where malaria control maintenance phase and smallpox has been controlled. Then later in other areas. The committee also recommended that multi-purpose health workers are feasible and desirable to deliver the health, family planning and nutritional services to the rural communities. The committee also recommended that to replace the ANMs by female health workers and basic health workers, malaria surveillance workers, vaccinators, health education assistants, etc. to be replaced by male health worker. The second main recommendation was staff and population of subcenter. So the committee recommended that there would be a team of 2 health workers, that is 1 male health worker and 1 female health worker at each subcenter. Then each subcenter should have a population of 3000 to 3500. So the committee recommended regarding subcenter there would be 2 health workers, that is 1 male health worker and 1 female health worker, and each subcenter should have a population or cover a population of 3000 to 3500. The next recommendation regarding female health supervisors. The committee recommended that the present lady health visitors to be designated as female health supervisor, and each female health supervisor to supervise the work of 4 female health workers. The committee also recommended that the present lady health visitors to be designated as female health supervisor, and each female health supervisor to supervise the work of 4 female health workers. The last recommendation was qualified public health nurse to be recruited in place of lady health visitors. So qualified public health nurse has to be recruited in place of lady health visitors. So these were the recommendations of the Kartar Singh Committee. Next is Srivastava Committee 1974-75. In 1974, Government of India appointed another committee under the chairmanship of Sri K.N. Srivastava. He was then Secretary to Ministry of Health and Family Welfare. This committee was also known as Committee on Medical Education and Support Manpower. This committee was also known as Committee on Medical Education and Support Manpower. The objectives were to devise the suitable curriculum for training the health assistants, to prepare suitable curriculum for training the health assistants, then to suggest steps for improving the existing medical education process, to suggest more steps for improving the existing medical education process. The committee submitted its report on April 1975. The committee were given the report on April 1975. The major recommendations of Srivastava Committee were: first is organization of basic health services. Organization of basic health services. There should be 3 tiers between the community people and medical officer, and creation of bands of para-professional and semi-professional health workers. Then establishment of 2 cadres, 2 group of health workers, and establishment of medical and health education commissions. Let us discuss in detail about the recommendations. So first one is organization of the basic health services. It including nutrition, health education and family planning. So the committee recommended to organization of the basic health services within the community itself and training the personnel within the community itself. The committee also recommended that there would be 3 tiers between the community and medical officer. That is village health guide, health worker male or female and health assistant. So between the community and medical officer there would be 3 tiers such as village health guide, health worker male or health worker female and health assistant. Then third recommendation was creation of bands of both para-professional and semi-professional health workers from within the community itself. For example, from school teachers, postmasters, gram sevakas to provide simple, promotive, preventive and curative services. So committee also recommended that creation of bands of both para-professional and semi-professional health workers within the community itself. The last one is establishment of two caterers or group of health workers, namely multi-purpose health workers, that is male and female, between the community health workers and the doctors at the primary health center. To establish the two caterers or group of health workers, that is multi-purpose health workers, male and female, between the community health workers and the doctors at the primary health center or medical officer at the primary health center. The last recommendation was establishment of a medical and health education commission for planning and implementing the reforms, the new steps needed in health and medical education. So, establishment of medical and health education commission for the planning and implementing of the reforms needed in health and medical education. So, these were the recommendation of Srivastava Committee. So, later Government of India accepted a Srivastava Committee recommendation in 1977 by establishing Rural Health Scheme in 1977 with the recommendations of involvement of medical college in total health care of the selected PHCs. So, involvement of medical colleges in total health care of selected PHCs. And second is reorientation training for multi-purpose health workers and uni-purpose health workers. So, Government of India started Rural Health Scheme in 1977 with two recommendations. That was the involvement of a medical college in total health care of the selected PHCs or connecting the PHCs to the medical college, and reorientation of the training of both multi-purpose health workers and uni-purpose health workers. So next is regarding reorientation of medical education, Rome 1997. So K.N. Srivastava Committee also recommended in relation to reorientation of medical education, Rome 1997. The recommendation were teaching and training of undergraduate students and interns at PHCs, primary health centers. Then exposing the faculty members of medical college to rural environment. Then upgrading the quality of health system both in rural and peripheral areas. Then organization of various medical camps. Then training of village health guides and utilizing their services in general health service system. Then last one is preventive, promotive and curative health care of 3 community development block in the beginning and later the entire community development block of the districts in which medical college is located in a phased manner. The next is Bajaj Committee 1986-87. Ministry of Health and Family Welfare, Government of India set up a committee on health manpower planning, production and management under the chairmanship of Professor J.S. Bajaj, AIIMS, New Delhi in 1986. So, Government of India appointed another committee in 1986 under the chairmanship of Professor J.S. Bajaj, AIIMS, New Delhi. This committee was also known as Health Manpower Planning, Production and Management. The Bajaj committees were given following recommendation. First one is to formulate the national health policy on education in health services. Second is to utilize the Indian system of medicines or indigenous system of medicines like homeopathy in the area of national health programs. Then continuing education program for all the health personnel. And last one is health manpower requirement in the area of nursing personnel. So health manpower requirement for nursing personnel. So these were the recommendations of the Bajaj committee. So we have explained all the major and important health planning committees in India. Then next is other notable committees. So there are other committees, they also contributed in the development of the health system and health services in India. So let us discuss in short or in brief regarding those committees, that is other notable committees. So next is about other notable committees. Other notable committees include Chopra Committee, Soki Committee, Shetty Committee, Mehta Committee, Renuga Rai Committee, Jain Committee, Krishnan Committee, Mehta Committee. There are 2 Mehta committees. The both committees are different. So in 1946, Government of India appointed another committee under the chairmanship of Colonel Sir R.N. Chopra. This committee, also known as Committee on Promotion of Indigenous and Modern Medicine. He has recommended for Ayush and the report is submitted on 1948. The next is Soki Committee 1947 under the chairmanship of Sahib Singh Soki. The recommendation were prescribing standards for dietary and nutrition for all cases of population. Then suggestion of ways and means for guarding against the incidence of various epidemics. Then investigation of infant mortality, maternal mortality, and providing suggestions of ways and means of reducing such a mortality in India. Then last one is provision of necessary health units such as hospitals, dispensaries, sanatoria, and nursing homes comprising physicians, surgeons, nurses, etc. So these were the recommendations. Then Shetty Committee 1954. Government of India appointed another committee under the chairmanship of Sri Shetty in 1954 with the objectives of to review the salary and working condition of the nurses in the country. To review the salary and working condition of the nurses in the country. The committee mentioned in their report a great shortage of nurses and following other deficiencies such as their pay scales were very low, they were overworked, and most of them worked for 50 to 90 hours per week, and they were made bear the cost of any breakages of hospital articles, etc. Next is Mehta Committee 1957. Under the chairmanship of Balwant Rai Mehta, Government of India appointed another committee in 1957 with the objectives of to assess the performance of community development program started by the government in 1952. In the committee's report, it was concluded that the program was failure due to the lack of local initiative or local participation. The next is Renuga Rai Committee 1960-61. So in 1960, Government of India appointed a School Health Committee under the chairmanship of Srimati Renuga Rai. So Government of India appointed a School Health Committee in 1960 under the chairmanship of Srimati Renuga Rai. The recommendations of the committee were promotion of preventive care through schools, provision of midday meals, health education as a part of the curriculum, and the integration of school health and primary health network. So promotion of preventive care through schools, provision of midday meals, health education as a part of the curriculum, and integration of school health and primary health network. In 1966, Government of India also appointed another committee, that is Jain Committee, under the chairmanship of Sri Jain, to review the working of the different hospitals and central health services. The committee given certain recommendation, that is 1 bed for 1000 population, and there should be 50 bedded hospital at taluk level. Then enhancing the maternity facility at each level, primary, secondary and tertiary level, and there should be an health insurance for the large population. So health insurance for the large population coverage. The Government of India appointed another committee as Krishnan Committee in 1982 under the chairmanship of S.V. Krishnan with the objective of to study the health services in urban areas and cities. So in 1982, Government of India appointed another committee as Krishnan Committee under the chairmanship of S.V. Krishnan to study the health services in urban areas and cities. Then in 1983, Government of India appointed another committee under Dr. Shantilal J. Mehta as Mehta Committee. This committee was also known as Medical Education Review Committee. Medical Education Review Committee. The committee given recommendation in part 1 and part 2. The part 1 for the report deals with the medical education in all its aspects, and part 2 of the recommendation specifically deals with the lack of availability of the health manpower data in India. That is lack of availability of the health manpower data of India. So the committee were given report in part 1 and part 2. Part 1 is related to medical education and part 2 is related to the statistics of lack of availability of health manpower in India. So let us discuss briefly about other committees. They include the committee includes Health for All by 2000 AD, report of the Working Group 1980, Working Group on Medical Education and Manpower Planning 1984, High Power Committee on Nursing and Nursing Profession 87-89, report of the National Commission of Macroeconomics and Health 2005. So first one is Health for All by 2000 AD, report of the Working Group 1980. A working group on Health for All was constituted by the Planning Commission in 1980. The Secretary of Ministry of Health and Family Welfare then was the chairman of this committee. The committee was appointed to identify the goal of Health for All by 2000 AD and to outline with that perspective the specific programs for the 6th 5-year plan. So for the specific programs for the 6th 5-year plan. Then Working Group on Medical Education and Manpower Planning 1984. The committee were given certain recommendation regarding initiate a scheme to induct the medical students for rural health services, and for this purpose reorientation of medical education scheme was launched later. Provide advanced training in public health management to the doctors, accord high priority to the training for nurses and other paramedical personnel, so high priority training for nurses and other paramedical personnel, and establish a university of health science, and through it establish a network of healthcare institution. So establish a university of health science and through it establish a network of healthcare institutions. Next is High Power Committee on Nursing and Nursing Profession. So in 1987, Government of India appointed another committee under the chairmanship of Dr. Jyoti, former Vice Chancellor of SNDT Women University, and later due to some reasons the committee was headed by Srimati Sarojini Varadappan, the former chairman of Central Social Welfare Board. The committee given certain recommendation related to appointment of ANM, lady health visitors, health supervisor and public health nurse. So 1 ANM for 2500 population and 2 ANMs for sub-center, and 1 ANM for 1500 population in hilly areas, and 1 health supervisor for 7500 population, that is for supervise the 3 ANMs, and 1 public health nurse for 1 PHC, that is for 30,000 population, and for to supervise the 4 health supervisors, and 2 district public health nurse officers in each district. This was the recommendation of the committee. The next is report of the National Commission on Macroeconomics and Health 2005. So Government of India appointed another committee under the chairmanship of P. Chidambaram, the Finance Minister, and Dr. Anbumani Ramados, then Health Minister. The committee were recommended for the promotion of equity by reducing the household expenditure on total health spending and experimenting with the alternate method in health financing. Then restructuring of the existing primary health care system to make it more accountable. Then reducing the disease burden and the level of risk of the public. Establishing the institutional framework for improved quality of governance of health. That is quality rendered health services. Then investing in technology and human resources for more professional and skilled workforce and better monitoring. So the tips for study of health committees and reports. So you can make the table like this and you can compare between the committees. So in that features include period of committee, chairman name, other name of the committee, then objectives of the committees, then recommendations of the committees. So here in short we have taken 3 committees, Bohr committee, Mudaliar committee and Chada committee, period 1943, 1959 and 1963. Then chairman Sir Joseph Bohr, Dr. A. L. Mudaliar, Dr. M.S. Chada. Then other name Health Survey and Development Committee. Then Mudaliar Committee is also known as Health Survey and Planning Committee. So you can compare with that Health Survey and Development Committee for Bohr Committee and Health Survey and Planning Committee for Mudaliar Committee. Then in case of Chada Committee, other name is the Committee for Maintenance Phase of Malaria Eradication Program. Then the objectives, then recommendations. The important point of recommendation, Bohr Committee, that is integration of preventive and curative health services. Then PHC in 2 stages, that is short term and long term. Short term is PHC and long term is in hospital. Then preparation of social decision. These are the 3 important recommendations of Bohr Committee. Mudaliar Committee also having 3 important recommendations and Chada Committee also having 3 important recommendations. Like that you can compare between the committees. Then in case of others notable committees also you can make the same table and you can list down some of the important points of the table and it will be easy to study and remember the features of the committee and the recommendations of the committee. So here you can make in brief like a period, chairman, features and recommendation together you can write. So this is the way and the tips for the study of health committees and their reports. So today we have discussed about the health committees and their reports. Introduction, list of health committees in chronological order, the major health committees in India and their recommendations, other notable committees and other committees and their recommendations. So thanks for watching. I hope this video will really benefit in your studies, and if you feel it is worth and beneficial, please share, like and subscribe. Stay tuned with the Angel Health Academy till we meet with another and important educational video. Thank you.